Okay guys, so we're going to be demonstrating another airway clearance technique. This is probably one of my favorite ones because it's super easy to do, it's super easy to teach. I use it myself whenever I have a little bit of chest congestion. It's called active cycle breathing or active cycle breathing. So we have Joe here who's been serving it as our mock patient. So this technique involves varying the tidal volumes or the volume of air that you breathe in each breath. The theory is by varying these breath volumes can help mobilize secretions, mucus out of the airways, okay? So Joe, what I want you to do, we're gonna do cycles of 3. So you're gonna do 3 normal breaths, followed by 3 deep breaths. We're gonna repeat that 3 times, and at the end of that final 3rd deep breath, that 3rd cycle, you're gonna take a big cough with that, okay? Any questions about that technique? And I'll cue you through, okay?
Good question.
All right, so let's begin. So Joe, 3 normal breaths. And then 3 deep breaths. Because you can go. Yeah. That's 2. That's 3. And then 3 normal breaths. Deep breaths. And the last cycle, 3 normal breaths. And then 3 deep breaths. And 3. Big cough. And we normally cue them to cover their mouths here for effect. You can also combine this technique with a few different other ones. You can add in that huff cough. You can also add in an inspiratory hold on that 3rd breath, really to put some stretch again on the airways. Other thing, most people teach it 3 breaths. The biggest thing is you don't want to have the patients hyperventilate, so you got to be cautious. You probably don't want to do maybe more than like 5 deep breaths. But if you want to do 4 or 5, that's probably fine. Just keep it simple for the patient. Obviously, Joe is young and healthy, but some patients may be a little bit more sensitive to those deep breaths, right? The fluctuations you can get, a little dizzy. So that is active cycle breathing.